Now, adequate healthcare for most vulnerable should be available without causing distress. That's according to Doctors Without Borders, who say that the current universal healthcare coverage neglects these access barriers. Their latest report highlights that 20 countries are struggling to provide their citizens with access to affordable and timely healthcare. Now, this is expected to be top of agenda at a high-level meeting at the United Nations. For more on this, we've got the spokesperson, Samantha Mkandhla. Thank you very much for your time this evening, Samantha. Let's talk a little bit about some of the data that's come out of the report and really how bad the situation is when it comes to governments, whether it be at a local government level all the way to national, providing basic healthcare services to people.
Thank you so much for having me. As an independent medical humanitarian organization, MSF responds to the medical needs of people affected by conflicts, disasters, and epidemics around the world. Now, what's crucial to that is that we work in partnerships with different governments, as you've highlighted, as well as other organizations that may be responding to a particular emergency that MSF responds to as well. Upon identifying gaps that MSF can respond to provide those medical needs, that is where we respond. So I don't have data specifically related to that question that you're speaking of, but what I did want to highlight is the impact of donations that we receive from people such as yourself and myself, and also as a representative for the Philanthropies and Partnerships unit that I'm speaking on behalf of today, or broadly speaking, the fundraising unit. It's really key that we get support from individuals, corporates, trusts and foundations, as well as donations from legacy gifts that then enable us, of course, to provide the services that we do provide.
And tell us about that level of donation and the provision of those critical resources that you do have. I mean, we've been hit with the pandemic. There is a higher cost of living and just generally a lot of pressures that individuals and organizations at large are facing. How much more difficult has your task been to gather the different resources that a Doctors Without Borders would need to conduct its work?
That's such a crucial point that you make. We are feeling the effects of the economy as well as post-COVID. Actually, we've seen different type of trends, regarding the donations that we do receive. So essentially, how we fundraise is we will advocate to get donations from individuals, anything ranging from 150 rands per month, or other times, depending on people's affordability, once-off donations. However, in addition to that, we focus specifically on corporate social responsibility, corporate social investments, and see where companies are able to channel some of those funds that they have per annum and give them towards organizations such as ourselves. However, we have also seen that companies have also taken a bit of a dip, and they're also focusing on other priorities, such as maybe just paying salaries and keeping their businesses afloat. So what we're also looking to turn to is, starting from last week, where we had South African National Wills Week from the 11th to the 15th of September, we are adding our voice to show people that you are able to give and make an impact to the lives that Doctors Without Borders works to benefit, or to impact rather, through your lifetime, but also through your will. We are able to be beneficiaries in wills of people who decide to put Doctors Without Borders, and what that means is that their legacy gift upon their passing actually assists us to continue to make an impact in the work that we do. In South Africa, for example, we are so proud of some of the advocacy work that we've done. We have Phumeza Disile from Khayelitsha in South Africa, who is the first South African female survivor of multi-drug resistant TB, and she's now an advocate as well. Because of the work that we support, which advocates to ensure that no large pharmaceutical holds the monopoly to accessing basic drugs that people can otherwise not afford or otherwise cannot access, we work to ensure that your donations, or the donations that we do receive, actually channel and impact people on a very practical level. And Phumeza is an amazing example that we have. But also with the cholera outbreak that we had recently in Hammanskraal, our teams were on the ground responding responding to that. And of course, you'll likely remember from COVID, we were also part of the team that established a temporary medical unit in the Western Cape as well, supporting with the medical needs that government and other organizations at that time were not able to fully facilitate. So in essence, we work in partnership with everyone, but this work is impossible without the donations that we get.
And let's speak a little bit more about those donations. I mean, we've had the pandemic. You spoke about TB and multi-drug resistant TB that is growing in different communities. There's increased heart disease. I mean, there's a host of new or developing diseases. And so one would wonder about the kind of medical equipment or resources you would need as a Doctors Without Borders to be able to provide essential services to communities. The call you would make in this regard to say these are the bare essentials that we need. We understand that the economic climate is not great, but if we could get this would be amazing.
Right. That's a very important question, and thank you for asking that, because for Doctors Without Borders, no donation is too small, and of course, no donation is too large. So, for example, in any emergency that we do have, the needs there would vary. After our teams do an initial assessment and exploration and determine the levels within which they are going to then respond, we have a host of needs that vary from salaries for our medical staff as well as non-medical staff as well, from actual medical equipment, other equipment such as any equipment that you can think of that would facilitate the provision of health services like a hospital. We set up temporary hospitals often. Other times it's even like specific things like PPE when there were shortages during COVID, and we needed to focus our efforts in ensuring that frontline workers, including our teams, are themselves protected first before they're then able to assist other people. So because of that wide scope of needs that we do have, we accept donations of all kinds, and we don't limit people. Sometimes people give when they can, once a month, or when perhaps something pivotal in their life happens and they receive a huge sum of money and they feel they want to give back, they can give back like that. Or people can also set up debit orders and receive donations in whatever amount they decide on a monthly basis. What would then happen is, depending on the emergency that we're responding to, or other times, donors are able to do what we call earmark a donation, which means they can tell us that here is some money. It is a donation from myself, and I would prefer it to impact, for example, your work in Mozambique. We do our very best where possible to channel the resources there. However, also keeping in mind that we have donations and donors, rather, from all over the world and other countries in addition to South Africa. We then, in support with our funding unit, find ways to channel the resources so it comes in as a pool of donations, and then utilizing that pool to see where then the greatest need is, how the donations should go. And because we operate on the values and principles of impartiality, independence, and neutrality, that also informs the transparency that we give to our donors. So donors are able to at any time ask us, where did my money go? And as best as possible, we liaise with our finance teams and do the best that we can to give rand to value cent, although sometimes it's not possible because, as mentioned, the donation sits in a huge pool. So we will then account for what that pool of donations did, and where possible, underline and show you where your money has also gone to.
No, thank you very much for that update. And I assume those watching and would like to contribute can go onto the website to get the necessary details to be able to make a contribution. Samantha, thank you very much for your time this evening. That is Samantha Mkandhla, who joins us from Doctors Without Borders, saying that no donation is too big or too small. They are in dire need of those resources, and you can make a difference in any way that you're able to do so.